Okay, hi everyone. My name is Natasha, and I'm an HPAC specialist. And who we have here today are some medical and pharmacy students from NEOMED, Northeast Ohio Medical University, and they will talk to you guys about college and healthcare. So, can you guys introduce yourself?
Hi, I'm Kuyan. I'm a year 1 med student.
Hi, my name is Aaron. I'm a first-year pharmacy student.
I'm Dominic. I'm a first-year medical student.
Hi, I'm Chandni. I'm a first-year medical student as well.
And thanks, guys, for coming here and to talk to these students about the healthcare field and college in general. So the first question I have for you guys is, in order to prepare for majoring in a healthcare degree, which type of science courses students should take while they are in high school?
I guess I'll start. This is purely based on my own experience and may not apply to everybody. So undergrad programs won't necessarily have too many prerequisites in college, but if you want to further get a medical degree after undergrad, you might have to take an exam like the MCAT or whatever the pharmacy equivalent would be. So in high school you have the choice of taking some AP courses that may give you college credit, like it could be AP Calculus or AP Biology. Now those are nice, but I wouldn't want to test out of those courses in undergrad, because then studying for the MCAT would be so much harder if you haven't seen biology or calculus for 3 years. So I would say go ahead and take those courses, but then when you're applying for college or when you're picking your classes for college, go ahead and take those courses again. I mean, you can take AP English and a test out of that, because writing essays is awful in undergrad years, so that's fine, but I wouldn't skip out on science courses. So again, I didn't have too many choices in high school, so I don't have too many opinions on what to take.
Also, there are these post-secondary classes where you can go to a community college near you and take classes that will count towards your undergrad degree. There are benefits and problems with this. It depends on you personally, but it would be a good option to look into, because if you can clear out some of your prereqs and you've taken them at a college level, then you'll be fine, and they will actually help you in trying to get your degree that you want, instead of figuring out how you're going to put everything in 4 years.
Okay.
Just from a different perspective, like Chandni was saying, I had an undergraduate degree in nursing, but many of my credits didn't transfer. I had graduated from nursing school in 2005, and most of my credits, usually they don't like to have so much time lapsed between the time that you graduate and the time that you're applying for school. They want the prerequisites to be kind of fresh. But I think it's really important to kind of hone in on what schools you're interested in, because different schools have different prerequisites. And so you could be taking a class that you think is a prerequisite, but then you come to find out that the school won't accept that credit. So it's really good to kind of hone in on a few different schools and then figure out the prerequisites that you need to take, assuming that your high school classes don't transfer. For me, like I said, I'm a non-traditional student, and I had a degree first, so that's something to take into account.
Okay. The next question is, how should the students receive scholarships and grant money?
The best way to go about finding scholarships or grant money is to go to your guidance counselor's office and talk to them. Usually they're kind of the know-all of free money for scholarships and grants, and usually they'll know what local scholarships there are to sign up for, they might have websites. There could be some crazy things that you qualify for scholarships for that you didn't know, like being left-handed or being red-headed, things like that you could qualify for that you wouldn't know otherwise.
Time is definitely a factor in getting grant money and scholarships, so whenever you're applying, just get on financial aid as fast as you can. You fill out your FAFSA form. I don't know if they would know what FAFSA is at this point, but to apply for financial aid, you have to fill out this huge form that ties to your parents' tax returns, and you just want to start filling out that as soon as it's available.
If you have a job already somewhere somewhat aligned with the healthcare profession, like you work in a pharmacy or you work in a nursing home, You can also find out from your employer if they offer some kind of assistance in exchange for a commitment to work. I know that's a route that many people take.
Also, clubs that you're involved in. A lot of times, like I did this, a lot of Key Club or any other club that your school provides you to join, you can get scholarship money through them because they will have forms for you to fill out. And again, like they said, guidance counselors are the best way to go about this. Or even online, doing searches. I did a lot of searches online that my high school didn't even know about, and I could get money for college, which is really helpful in the long run.
Okay. The next question is, please describe the importance of studying for the ACT and SAT. How should the students study for these tests?
Well, I'll just go from my perspective, and then I'll let somebody else offer the counter perspective. For me, the SAT and ACT was almost not relevant at all. I don't want to impress that upon you that it's not relevant, because if you can do well on that now, then it's probably good that you should do so. But I'm a non-traditional student. I'm 31 years old, and I was a critical care nurse I am a critical care nurse, but I've been doing nursing for 9 years. At the time, 2001, when I took the ACT, I believe, I didn't score that well on it. I wasn't as serious of a student as I am now, and I probably wouldn't have gotten into medical school at that time with those scores. But for someone who's thinking about maybe going to medical school or pharmacy school later down the line, you'll have there's always opportunity. There's never any closed doors. You just have to be willing to work to get it. I didn't have to retake any SAT or ACT. I took the PCAT, which is the pharmacy college admission test, and then I had to take 2 years worth of prerequisites at community college. And it was very difficult. It was physics, chemistry, organic chemistry, biology, calculus. So it was very hard work. But I think that for students coming out of high school, I think they should definitely try and do as well as they can on the SAT and ACT.
Yeah, it's the one thing about the ACT and SAT, like you could be acing all your classes in high school and still bomb the SAT, because the questions are kind of made as puzzles. So I would recommend like some kind of preparation, and like either an SAT prep course or just get like a Kaplan SAT book and just kind of go through that and get used to the format of the questions, because like even if you don't remember anything from algebra, if you just study like the SAT prep book, you could kind of get an idea, because it doesn't really require a high level of knowledge of the material. It's really, you have to gain test taking skills for the ACT and SAT. So you could be like an average student in high school and get a great SAT score. It could be like a valedictorian and bomb the SAT. So just do some kind of preparation, just know what the format is like.
Yeah, exactly. It's prep books, practice and practice, because even if you're a good student, ACT, SATs are difficult to you, because if it's the first time you're going into this room, you don't know how the test is going to be, how the time is against you, and how you're supposed to work through a question. So prep books help you. They tell you what you should be looking for in a question, what you should avoid, so you can save time and do the best you can, show that you're the best candidate to your colleges, because that's the first thing they look at. Many programs that I looked at, the first thing that I want to see is this person above a certain ACT or SAT score? Then we'll look at them. Sometimes they don't even consider you if you're too below the mark. So again, when you're looking at these colleges, definitely look at what score they usually admit people into, and what you have to do towards to get that score, and keep practicing. I would definitely have some prep before you go in for the first time.
Okay, so now we in the second section of the panel discussion about the healthcare field, and my first question is, how did you become interested in the healthcare field?
Well, I became interested in the healthcare field because I really liked science, and I really liked the body and disease and everything that could go wrong with the body. So I figured, why not devote my career to fixing those things? And so that just kind of led me here.
Okay. The next question is, how is your experience at medical school?
I'll take that. Gut-wrenching, tired, lack of sleep, like very hard, difficult. But then I go and shadow a doctor at a hospital and see a real patient and see their interaction and then see like how much they appreciate what the doctor's doing for them. And I'm like, oh, so that's why I've been like doing this. Or maybe he'll mention something that I learned in class just like a few weeks ago. I'm like, oh, so that's why we had to memorize that. So it's difficult, but it feels right, and you can really see like how it's going to pay off in the future. Like it's not theoretical; it's going to have a very real effect in the future. So.
Okay, great. What are the opportunities and challenges of being in medical school?
I can talk about that, I guess, a little bit from the pharmacy school perspective. You really have to, it's a lot different than undergraduate. Coming out of high school, you probably, if you go to an undergraduate school, you probably think that that's a step up. But then graduate school is really another step up from that, and it's just, you have to be very disciplined, and like the most important thing for me was time management. Just getting into a system where I came home from class, I'm tired, not motivated to study, but I have to study because it's not always that the content is so difficult. It's that they throw a lot of content at you. They told us the first week, what you take a week or 2 weeks to learn in undergraduate, we're going to be covering in a day. So you have to be very disciplined, and you have to budget your time well.
Okay. And the last question for this section is, what are your plans after graduating from medical school?
I guess I'll take this. My plan after graduating medical school is to become a world-famous pediatric surgeon who is able to operate from their yachts. But really it's just to go on, do residency hopefully in surgery, and then hopefully pursue a fellowship after that. A lot of people don't understand how that works, but after medical school you go into a residency where you're actually trained how to be a physician, and that's where you become the specialist or whatever type of doctor you want to become. So hopefully I'll do a residency in surgery and become a surgeon.
Okay. Now we at the last section of the discussion, and these are questions that doesn't fit into any topic at all. So the first question is, what are the different pathways to get into the healthcare field?
I can answer that. I mentioned earlier that I was a nurse for 9 years in the critical care setting, ICUs, post anesthesia care units. I did travel nursing for 4 or 5 years. Before that, I got into the field because my mother is an anesthesiologist, and she thought that I would be interested in that profession. I started out as a patient transporter in the hospital, just shuttling patients. And it's really important, I think, to get your foot in the door. Before you even get your foot in the door, I think you have to know that this is what you want. You like helping people. You're interested in science. You have good people skills. It's a very, very big decision, and if you're not sure, I wouldn't recommend just doing it. I would recommend some kind of shadowing experience, just to see if it's something that you would like, or if you curdle at the sight of blood, it might not be for you, So, I mean, there's many different ways to be involved in the healthcare field. There's administration, there's coding, where you deal with insurance companies, and it's not just all patient hands-on.
Like a biomedical engineer.
Yeah, you could develop medical equipment, or you could go into research and create new drugs. So there's so many ways to be involved. You just have to research it, and anything else.
Okay, and the last question is about NEOMED, and it's about a specific program here. So what is the BSMD program at NEOMED?
So essentially it's a 6 to 7 year program. It involves you going to an undergrad for 2 to 3 years, depending on what you want to do, and then moving on to med school. You have a guaranteed seat, but it doesn't mean that you can just slack off in undergrad either. You have these requirements you have to meet for your MCAT, your GPA, and everything else. And if you are able to meet these requirements, then yes, you will go on to phase 2, which is med school. I went through this program. It is very rigorous because right out of high school you're expected to be, disciplined, very mature, and you have to be on your toes the entire time. And it's a little different from a normal undergrad experience because you go to school in the summer as well, and it's 4 years of education, 2 years, or 3 if you want to do research or increase a year in courses, depending on what you'd like. And the process is, when you're in your junior year, you would apply to NEOMED, and then you would go through your interviews. If they accept you, you have to write an essay. You have to do well on your ACT or SAT, and you'll have, the other normal process that you have to go through. And if you're selected, then you would start the summer of your senior year. So you don't really get a summer, but it's a different experience. If you're sure that you want to go to the medical school soon, then this is something you can do. If you're not sure, then I don't know, you might want to consider this program. It might not be for you if you're not completely sure that this is where you want to end up. You want to know what you're getting into. It's not an easy program. And a normal undergrad experience is just as great, but this is just another way of getting to where you want to be. Either or way is perfect. Like, as you can see, we all have different backgrounds. If at the end you want to get to medical school and be a doctor, then you can go any route you'd like. You just have to be determined and be ready for the challenge.
Okay. Well, thank you everyone for giving your input on these very important questions for students to take into consideration if they want to go to college in general or if they want to go into medical school. So again, thank you.